First, we're going to talk about other communicable diseases. This is a review of the communicable diseases that we saw before we entered into this break because of COVID-19. The first one that we were discussing in class that we didn't see so much because of the time is arthritis. If you remember arthritis, we discussed that it's not a disease, it's a condition. What's the difference between a disease and a condition? The difference is that a disease can be caused by an external factor, either a virus, a bacteria, or any other external factor that is not on your body. On the other hand, a condition is something that you develop, that is part from your own body, and depending on different circumstances, they will develop over time. In the case of arthritis, arthritis can be considered as well a condition because it's something normal, supposedly. Something that is part of aging, something that is part of growing up. So in this case, we are talking that it's a condition that develops over time. It's not a disease, okay? There is not a determined thing that is causing arthritis in people. We do not have a specific cause for this. It is something that happens over time, okay? And it is a condition that makes the joints feel pain and swell. When I talk about feel pain, that means that when you try to move your hand or when you're trying to do something like this, you will start feeling a really, really big pain. And what happens is that you will feel an inflammation. That's the meaning of the word swelling. Your hands will start inflamming to the point that they will be difficult to just do this kind of action or take something with your hand, etc. So arthritis, even though it appears on people that is older, it can happen to people at any age. Even if you are an adolescent, even if you are an adult or a kid still, you can also have arthritis. The reason why is because there are some actions that they may accelerate this process to appear on the body. We will see that in detail. So first, we're going to see the first type of arthritis that we discussed a little bit in the class before we went on this break. And the first one is rheumatoid arthritis. In order to not be so repetitive, I will mention rheumatoid arthritis as RA, okay? It's a condition in which the body joints become swollen and painful. A cartilage that separates the bones is affected and they become deformed and stiff and no longer function normally. This means the following, like for example, if you look at your hand, between this section of the bone that you have in your forearm and your hand, you have a cartilage, right? A cartilage is the muscle that helps you to do this, to move your hand freely in any way, shape, or form that you want. As well, we have some on our fingers and in other places of your body. If you go to your legs, you will have them in the middle of the knees, and that is the cartilage. And what happens with the cartilage is like a type of muscle that is elastic, okay? And what they do is that they make sure that you can do these actions, that you can move in a determined position, etc., etc. But what happens when you have arthritis, this cartilage gets deformed. So that means that it's starting losing its shape. Therefore, they will become more thinner, and thinner. And when that happens, it's like the two bones that you have, they are like this because in the middle you have a cartilage, but later they will get closer and closer and closer until the point that they will have some friction against one another. When that's happened, there is a lot of pain because there is no resistance, there is not something between them that will cause them to be separated. Also, they become stiff. That means that people who has this condition, they cannot move their hands in a complete action like we do. For example, if I'm doing this with my hands or something like this, they cannot do it because their hands become so rigid. That means that they cannot move it. They cannot do something like this. Or if they can, they will do it like this. Like kind of with difficulty because they feel that stiffness. And as well, the hands do not function normally. For example, imagine that I have a cup over here with me. Normally, when you grab a cup, you do it like this, right? From the handle, with your hands. But if you had arthritis, you won't be able to do that. That is a normal function that our hands have. Instead of trying to handle it like this, probably people will start doing it like something similar to this because they cannot close their hands on the handle. That's the difference that they have. The main parts of the body that are affected are the hands, the feet, the elbows, the knees, the hips, and the spine. Normally, this condition is symmetrical. What is the meaning of symmetrical? That it happens on both extremities at the same time. For example, if you have RA in one of your hands, you will have it in both hands at the same time. It's not just going to be in one. It's going to be in both hands, in both knees, in both legs, in both parts of your hips, etc., etc. So basically, that means that a way to identify rheumatoid arthritis is that if you have the same feelings or the same symptoms in both sides of your body, okay? It is not known exactly what causes it, but the most common theory is that it can be caused by an infection or an injury. We already saw what's an infection, right? An infection, if you remember, is when a microorganism enters into your body and they start deforming the cells to create an infection. Or an injury, that means a hit or an accident that you may have, like you break a leg, you break an arm, you fall up from the stairs, and therefore you develop this kind of condition. When we talk about this kind of disease, there are many ways to treat it, not to cure it, but to treat it. Because there is not a cure for RA, but there is a way to keep the condition in a good level so it doesn't get worse over time. So over here, since there is no cure for RA, joints and tissues, the damage can be replaced by surgery, okay? They can be replaced, but they cannot be cured. So the damage on the tissues. So that means that they can do a little process in which they're going to repair it little by little to make sure that you recover a little bit of the mobility that you used to have. But the most important treatment focuses on relieving the pain and preserving and improving joint functions. Basically, the treatment that they give to people is, one is, first, they give medication for the pain, because the pain is really, really, really one of the things that people deal with the most with arthritis, especially when there is a cold weather. When there is a cold weather, they feel a lot of pain on their extremities. Also, over here, we are talking about that, in this case, they want to preserve the joint function. So that means that they want to preserve the ability of the organs to keep on moving, to work normally, or even if it is possible, to try to work better if there is some damage already made. And that's why you see that some actions that doctors take in order to make sure that people get better from this are rest, okay, so that they don't work too much. People with arthritis are told that they shouldn't effort that much their extremities that they have in danger. Medicine, the one that the doctors give to them, the posture is important because the posture is the way in which you balance the weight of your body overall, okay? If you have a bad posture, that means that one part of your body is going to feel more the weight than the other. It happens to all of us. If you notice, we all have a feet that is the one that we keep balance on. That is our strongest feet. For example, if you are somebody that uses your right feet, it's that one. And if you are somebody who uses the left feet, it's that one. And what happens is that, imagine that you push all of your weight in just one feet, probably you will fall down because you are feeling all the pressure just in one side of the body. Heat, because as I told you, cold, people when there is a cold climate, they will have some problems with their extremities because they will start feeling a lot of pain and inflammations. Over here with exercise, this is going to be helpful for them to recover the mobility and everything, as well as the heat is going to make sure that they don't get inflamed on their articulations. And the diet that is essential. People with this kind of diet, they cannot consume something like it is, for example, with salt or many carbohydrates because it is going to accelerate the process of the inflammation. Then we have the next one, the next type of arthritis that we're going to be dealing with, and that is osteoarthritis. So this is the most common type of arthritis that results from wearing and burying the body joints. What is the meaning of this? This is the common type of arthritis that will happen over time to most of us, okay? Why? Because even though you have your cartilage that are joining together the two bones or the two extremities, they will reduce over time, okay? They will become thinner and thinner. They start like this and they will become thinner and thinner and thinner over time. Until you feel like probably you cannot move your hands so freely. Probably you have seen this with your grandpa or grandma, that they cannot move their hands so well or their feet so well because of this issue. It affects the joints, the hips, and the knee, okay? The joints of the hips and the knee. So that means that this part over here, which they used to move around, it is going to be affected. And the knees as well, because the knees are the ones that are supporting all the weight of their body, as you see over there. This is a natural part of aging, as I was explaining, because this happens over time, okay? All of the cartilage that we have, they will start reducing their capabilities over time. And when we get to be elder people, we're going to lose many of the capacities that they have. Pain and stiffness in the morning is one of the symptoms. So that means that people, when they wake up, they feel a lot of pain either on their hips or their knees, and they cannot move them properly. Probably they have some problems to move their knees, to get out of bed and something like that, because in that case, that's one of the main issues that they have. Pain or swelling of a joint and stiffness in the lower back or knees are a warning signs for OR. That is the name for osteoarthritis. So these are the signs that you can indicate, okay, if you feel like a certain stiffness in the lower back, so that means that you cannot move it freely, or you cannot do this action or something like this, that means that it is an indicative that osteoarthritis may be taking place. And that's when we should go and consult a doctor, okay? Then we have the next one, that is what is diabetes. And diabetes prevents the body from converting food into energy. That is the other type of communicable disease that we have. And in this case, diabetes is a really, really different disease compared to osteoarthritis and arthritis, okay? So the first one is the disease that prevents the body from converting food into energy. If you remember, when we were talking about the digestive system, we discussed that all the different parts of the digestive system, they are used in order to make sure that everything works properly. They take all the food, they store it in your stomach dissolves it, the small intestine absorbs all the nutrients, and the large intestine will excrete all the things that they don't work. Diabetes is caused by the problems with the production and the function of the hormone called insulin. Insulin, if you remember, is one of the substances that is created by the liver, and it regulates the level of glucose in the blood. Therefore, it is important, because if you are not able to regulate the level of glucose in the blood, you can start experiencing diabetes, because this sugar will go everywhere in your body and they will start affecting other functions of the body as well. So there are two types of diabetes. The first one is diabetes type 1 and diabetes type 2, okay? So just give me a second. I will be back. So as I was telling you, there are two types of diabetes. The first one is diabetes type 1. That is the result or no, a little bit or no insulin produced by the pancreas, okay? So that means that in this case, there is not a big amount of insulin or a normal amount of insulin that is produced by the body, and people just have a little bit of it. When you have just a little bit of insulin in your body, that means that you cannot regulate the amount of sugar or of glucose that you have in your bloodstream. Therefore, this is going to cause many, many problems for people that has this disease. For example, they can start presenting problems like blood clotting. If you remember, we discussed that in class. That is when, for example, your blood, all different red, what was the name of that? The red hormones, they get just in one place and they start creating a cloud that blocks all the passage of blood through the body. This sickness or this disease is caused by genes, okay? So that means that it's genetically. That doesn't mean that it's caused by any other factor like a virus, a disease, or something like that. It is part of genetics. But there are some people or some investigations that say that environmental factors, or in some cases viruses, they may be a trigger for the disease. Not the one that causes them, but the one that is like similar to cancer. If you remember, I told you in the classes that cancer, we all have the cancerosinous cell in our body. The difference is that they need a trigger. What's a trigger? For example, imagine that you have a gun. A gun, they have a trigger, something that you pull in order to shoot it, so it can cause some damage. The same happens with the body. Over here, we have these cells all over the body, and it can happen at any time. And if there is an external factor that pulls the trigger, then it's going to shoot and it's going to spread the disease overall. Therefore, this is a big problem, because since there is not a way to determine what is causing it completely, there is not a way to cure it, and there is not a way to treat it. There is a way to keep it at check, so that means that people with diabetes can have a normal life, but it's not a way in which they can cure it from the disease, okay? The next one is diabetes type 2. That people with diabetes type 2, they make insulin, okay? They can still produce insulin, but their bodies do not use it as well as they should. what happens over here is that the body of the person with diabetes type 2, they becomes resistant to insulin. So that means that in this case, they cannot absorb that. And the body needs to be absorbing that kind of component. And the first thing that you see is that the pancreas makes insulin to try to get the glucose into your cell. But eventually, it cannot keep up the glucose builds up in the bloodstream. What happens is this. Your pancreas is producing insulin, right? But your cells, the cells of your body, are rejecting the insulin. Therefore, the pancreas interprets this as a message that I am not producing enough insulin. That's why the body is not receiving all the insulin that it has or that it needs. Therefore, I will make more insulin, okay? More, and I will deliver it through the bloodstream. This is a problem because when this happens, the glucose will make the same thing that the blood clots will do with diabetes type 1. They will block the arteries, they will block the bloodstream, and people will have many problems related to their heart and lungs and many other stuff. Therefore, this is an excess of insulin that is being created because the pancreas is not receiving a feedback that the different glucose is getting to the different parts of the body. And as well, we're going to see how these diseases are, what are the main difference between the two of them. You see right now that we have a chart on the screen that is going to show us some of the difference. Further definition. In this type 1 diabetes, we have the beta cells in pancreas are being attacked by body's own cells and therefore can produce insulin to make sugar out of bloodstream. Insulin is not produced. Pay attention to this one, okay? The beta cells in the pancreas are being attacked by own cells, okay? So that means that the same immune system of your body start attacking your pancreas. That's why it can produce less insulin than before because it's losing some of its functions because it has been receiving some damage, okay? So in the case of diabetes type 2, diet-regulated insulin release is so large and frequently that receptor cells have become less sensitive to the insulin. What we are talking about over here, that is the pancreas is creating more and more insulin that the different cells in the body that receive that insulin, they can become less sensitive. So that means that they feel that they are not receiving enough, okay? The insulin resistance results in less sugar being removed of the blood, okay? Less sugar being removed from the blood. So that means that the sugar, if you remember when we saw the circulatory system, there is one of the, we have the veins and the arteries, one is in charge of transporting the blood, one is in charge of cleaning the blood. But in this case, one of them is in charge of removing all the sugar from your body. The second difference is the diagnosis, because some people believe this is not completely true because we don't know exactly what causes this, but these are the most commonly accepted factors. First, genetics, environmental autonomous factors, and idiopathic, okay? In this case, in the case of the diabetes type 1, we talk about genes that it can be transmitted from generation to generation, and the conditions of the environment, supposedly contamination or the conditions in which a person lives. Or idiopathic, so that means that the immune system of the person is not working properly. In the case of diabetes type 2, it can be caused by genetic, okay? It can be transmitted from family to family. Obesity, okay? That means that your overweight can cause you to have diabetes type 2. Physical inactivity, so that means that not doing exercise at all, especially right now at this time that we are all at home and we cannot do much, it's important for you to keep physically active in order for you not to develop a condition that can get worse over time. How? And low birth weight, so that means that if when you are born you have you are or too fat or too thin, it's going to determine if you will get the disease later on in life. GDM is similar to genetics, deformity, the poor placement growth, and metabolic syndrome, okay? So that means that a problem in your metabolism and absorbing the nutrients and how they work together. Then the warning signs, the things that we need to be preoccupied in the case that we're dealing with diabetes. In the case of diabetes type 1, these are the symptoms that determine if you have it or not. Increase of thirst and urination. That means that you feel thirsty. You drink a lot of water, a lot of water, and then you start urinating almost all the time. That's one of the warning signs. Constant hunger, weight loss, blurred vision, and extreme tiredness. So what is this? So you will start feeling like you're always hungry, okay? You're always hungry, even though you eat a lot, you will feel hungry all the time. But at the same time, you will lose weight because your body is not processing all the nutrients and everything. Blurred vision, so that means that you cannot see everything clearly, and extreme tiredness, that you feel so tired that you don't want to get out of bed or you cannot even walk, okay? In the case of diabetes type 2, feeling tired or ill, so that means that you feel without energy, without any emotion, frequent urination, that you're still always urinating all the time, unusual thirst, that you're thirsty all the time, weight loss, that you're losing weight, blurred vision. In this case, this is the key difference between the two. Frequent infections, okay? Frequent infections, that is, you will get infected probably from your throat, from your ear, from many other parts of your body. And finally, the slow wound healing. So that means that if you get a cut, it will take more time for you to probably to create a crust over here and for your immune system to create a barrier to cover that. If these people are asymptomatic, so probably they don't start presenting the symptoms. That is one of the cases. And that's why it's tricky to determine if somebody has diabetes type 1 or 2. Okay, and how do you treat it? Well, people with diabetes type 1 need to take insulin every day because they are producing less. Therefore, they need to take a supplement that will help them to produce the regular amount, okay? And also they need a good diet to make sure that they are not eating something that is going to go against. With type 2 diabetes, they take some medicines that help them lose the body, the insulin that body makes. And the diabetes cannot be cured, but if left untreated, that means that if it is untreated, basically the same ways. Diabetes type 1 or 2 can be treated in the same ways, either by diet, by some medicine, that in this case is insulin to regulate the blood glucose on the bloodstream, and as well with exercise. And if it is untreated, it can lead to blindness, loss of a feeling, or a lot of pain in either hands, or kidney failures and hardening of the arteries. We discussed already what happens when the arteries get hard. That means that they cannot transport the blood as they should because they are not elastic enough to move the liquid all over the body. And with that, we finish with the review of the other communicable diseases. In the next class, we're going to talk about the unit number 5, that is avoiding substance abuse. That is the one that we're working with right now, where we'll talk about how to deal with tobacco addiction, alcohol addiction, and the benefits of being free of all those stuff. So right now, at this time, I will stop recording. Okay, so if you have any questions, this is the time to ask.